Hey guys, it's Boba. Today I have with me Zettery.
Okay. Hi guys, I'm Zed.
Yeah, and today we are going to be talking about what are you going to do if you accidentally knock your tooth out. Okay, so by knocking your tooth out, I mean dental trauma. And dental trauma is something that is it's actually more common than you think. And it can be something as simple as falling down and knocking your teeth. Personally, I think both of us here, we have had experiences with dental trauma. So Feng Hua, maybe you want to share your experience?
Okay, sure. Thank you, Boba. So what happened was that when I was 15 years old, boys are always very playful, like to play on the monkey bar, like to climb around. Well, for me, there was this long hill cafeteria board at the canteen. Yeah, so my hands were itchy lah. So what I did was I tried to do a pull-up on the cafeteria board sign. And what happened was that the board actually fell on me, and on top of it there was a rusty nail. So I actually cut through my lips, and at the same time, my jaw actually hit the ground. Yeah, so at the same time, I think my tooth actually hit the ground too. So what happened was I actually went to I went to some hospital, but the hospital didn't accept me because of my trauma. So I actually had to transfer to another hospital, which is NUH. So when I was at NUH, they cleaned the wound and all. They did not actually take an X-ray, but my main concern was actually at that time was a laceration on my lips. So what happened was they fixed up my laceration and it was swollen. Yeah, it was really very swollen. So I think I have a picture. I can send that to you. Yeah, I can find and send to you.
Wait, so the long rusty, what happened to the long rusty nail?
Oh, so the long rusty nail actually it came up from the signboard, and it actually pierced through my whole lips. Yeah, so I actually have a few stitches here and there on my lower lips.
Okay.
Yeah, so now there's like additional growth here.
Oh.
So you can see the additional.
Oh yeah, I didn't notice that.
Yeah,
Actually,
so there's like extra flesh there lah.
I've been his friend for 3 years and I didn't even notice that.
Yeah.
Oh my goodness.
It's very normal. At first it was very swollen. Yeah,
Very swollen.
so after that, but it was at the point where I have a trauma. I had trauma to the tooth, but I didn't actually realize that I had trauma to the tooth.
I see.
Because I actually felt no pain at all. But what happened, I think, was it was only after I entered dental school, then I started to take more care of my teeth, start to look at the mirror more, check myself out,
Yeah.
Yeah, that's when I realized, why is this teeth discolored? Yeah, so yeah,
that's why you noticed your tooth was
yeah, that's how I actually
okay.
noticed. And when we started the endo module, then that's why I realized that actually my teeth actually needs endo. Yeah, and actually we have during pre-clinicals we actually had to take DPT. Yeah, that's where I actually found out that I actually have a periapical lesion also. So it's like there's an inflammation at the apex of my tooth.
Okay, I see. Well, that's okay. So Feng Hua has kind of skipped the gun here a bit by touching more on the dental side, which we'll touch on later as well. So, wow, that's a very crazy story that I just heard. Holy shit! Wait, so you climbed this like signboard with the nail, and then it fell. Everything just fell out. Then you knock which tooth? Upper or lower?
Actually, when I fell down, I actually knocked. I think I knocked my jaw, then fall. I think I lie flat on the floor.
Oh, so you hit upper teeth.
Yeah, I hit my upper teeth.
Oh, okay. Wow. Maybe I should have gone first. This sounds crazy, man. So for me, my experience with dental trauma is not that bad because I wasn't the victim. Okay, in a sense, I was a victim because what happened was I accidentally reverse headbutted some guy. Not some guy, it's someone I know as well. So basically, he was my opposition in football. He was a defender, and then there was a high ball, and then I just jumped backwards trying to hit the ball, and then the back of my head knocked his teeth. So what happened to him was he had his 2 front teeth chipped off, and then he had to go for root canal and crowning for those also. Okay, so as you can see, mine pales in comparison compared to Zed's experience, but as you can see from both of our experience, dental trauma is quite common. And then, so now let's move on to how to manage your tooth if you knocked it out or your tooth gets chipped. And then as we progress on with the management of such dental trauma, we'll touch more about Feng Hua said with regards to, what do you say, discoloration, tooth discoloration, endo, what's endo, and DPT and PA lesion, yeah. So we'll touch on those as well. What do you do immediately when you first knock out your tooth or when your tooth first gets hit by trauma? Maybe Feng Hua wants to share what can happen to your teeth when it gets impacted by trauma. What are the possible outcomes that can happen?
Okay, when it gets impacted by from trauma, I think possible outcomes are maybe in your case, the tooth gets chipped.
Yeah.
Or sometimes it can be pushed into your socket.
Ooh, yes.
there are a lot of different ways that things can happen to your teeth lah. So after a trauma, it's best to actually seek dental help immediately.
Okay.
Yes, don't just push it off or assume that once the pain goes away, everything will be fine, because in fact it doesn't. Yeah, so seek help.
Right, so Feng Hua has got it right. You have to seek help as soon as possible if your tooth encounters trauma. So if let's say if your teeth gets pushed into the socket, or nothing happens to your tooth, it's fine. You don't have to do much. You just quickly go and see the dentist. But let's say what happens if your tooth gets chipped off or your whole tooth can drop out from the trauma? What do you do then? The key principle of this is to keep your teeth as vital or as alive as possible. So as the longer your teeth is chipped or out of the socket, the higher chance that it's dying. As it slowly deteriorates over time. What you have to do to preserve the vitality of the tooth is to actually, you either put it under your tongue in saliva, or if you somehow have a cup of milk lying nearby, you quickly throw in the milk and then you quickly go and see the dentist. What can happen if your tooth doesn't drop out of the socket is that your tooth still can die. And then how do you know it dies is if you see it gets discolored, like what Feng Hua said at the time. Your tooth being discolored is something that happens over time. So it's not something you would take notice of immediately. That's why, as Feng Hua said, if you encounter dental trauma, you knock your tooth, quickly go and see a dentist ASAP. Yeah. So just now Feng Hua mentioned about having a DPT as well and seeing a PA lesion. So when you go and see the dentist, usually what they'll do first is, if you don't have a present X-ray, or maybe because you just had new trauma, they'll probably take an X-ray first, and then this X-ray is called a DPT. So DPT stands for dental panel tomography, which is basically a full mouth X-ray. And then from there, they will deduce like the overall or the general condition of your tooth. And then if your tooth is dead or there's some infection, you can see a PA lesion. So what we mean by PA lesion is that underneath the root of your tooth, there's like a black circle, which means that there's like infection there. It's all the infection substance. So moving on from there, when the doctor confirms the tooth that he wants to treat, he will start endo treatment. Endo is a short form for endodontic. Feng Hua actually has just recently gone through one. You can check out his vlog on Instagram. Yeah, so he had the honor of seeing one of the specialists that teaches in our school. Yeah, so I think it's better for him to walk us through what an endodontist will do for you if you need to undergo root canal treatment or endodontic treatment anytime. Yeah. So.
Thank you, Uba. So what happened was, actually many people are very afraid of endo treatment, but actually I tell you there's really nothing to be afraid of. It's actually it's actually quite a okay procedure to go through. But of course the success rate is around 85%. It's not a 100% success rate. So you do have to keep your options open. Yeah. So what happened was, I went for treatment recently, around 1-2 months ago, and that was like I had my injury when I was 15 and now I'm 23, so it was 8 years ago.
Yeah, so don't be like him. Don't wait 8 years to see the dentist.
Yes.
Go and see 8 minutes, not 8 years, please.
Correct. Because I didn't have enough awareness back then to know that, my teeth could actually have some problems and all. That's why I only seek treatment now. So that's why Boba is actually making this video to educate you all. Yeah, so seek treatment early, and who knows, if you have a trauma, you can even look for him too. For me, actually, look for Dr. Lee. So what he did was, we actually had the endos done in 2 sessions. But for mine, my case was a little bit special because I actually have braces on. So some people might say, if I have braces on, can I still do endo? The answer is yes. But of course, you have to let your orthodontist know that, you are going to do root canal treatment. And at the same time, they'll make sure that they do not put any active pressure on your tooth. Active pressure in the sense that, because braces, we are actually wearing a lot of rubber bands, a lot of metal wires.
So they're trying to move your teeth. And then by active pressure, they want to not put so much force on the teeth and basically move it less. Right? Yeah.
Yes, correct. So they actually don't move the tooth as treated. So for my case, my upper arch was actually not moved during the time where I had endodontic treatment. Okay, so my lower arch can be moved, but my upper arch, which this teeth is discolored, didn't move at all. Okay, so what happened was, during the first session, Dr. Lee actually did access cavity. So what is access cavity? For those with chipped tooth, your dental pulp might actually be exposed really. Okay, all these are very very dental terms.
Dental pulp is basically the nerve in your tooth. So like when you have toothache, everything, whatever transmits this pain sensation to your brain for you to feel it is this nerve in your tooth called the dental pulp. Yeah.
That's correct. So root canal treatment is actually removing all the nerves in the tooth. That's why you won't feel any pain. So what happened was for the first treatment, it was around 2 hours. Yeah, so it was a very fast one. So once I hit that, I actually took a X-ray. We actually took a PA. So PA is a peri-apical. So the X-ray is actually a single tooth X-ray.
Yeah, it zooms in on that one tooth. And I want to clarify that when Feng Hua says remove the nerve, right? It's because the nerve is already dead.
Correct.
Right? The nerve is already okay. So most of the times they won't remove the nerve if it's alive. Correct. As much as possible, we want to preserve the tooth to its original condition. But then, for example, if the tooth is on the verge of dying or it's already dead, then that's when they remove the nerve. Okay, so Feng Hua can continue. Yeah.
Okay, so during the first session, they did the access cavity.
Yep.
Okay, and they did something called cleaning and shaping, which is to remove the nerves in the roots. Okay, then after which they actually put in calcium hydroxide. So what is calcium hydroxide? It's actually a intracanal medication. So it's think of it as something like antibiotics inside your root to kill out all the bacteria.
Yes. Feng Hua, you want to elaborate more on why they have to clean and shape?
Okay, so for cleaning and shaping, because how do I say your canals are actually different canals have different sizes, correct? Yeah. So what we actually do is we actually shape it in such a way that we have to actually prepare the tooth in such a way for root canal treatment lah. So by cleaning and shaping it, right, we're actually preparing the tooth because the next step, which is the next appointment, will be filling the empty spaces up.
Filling the empty. Oh yes, correct.
So we actually have to clean it out and at the same time remove any what we call necrotic pulp, which is called dead tissue. And because once the dead tissues come out, the bacterial load in the teeth also decreases.
Bacterial load is what causes your PA lesions. We also want to remove it because as any structure in your body has to be as clean as possible. If not, there'll be body reactions to it, and then that can cause reinfection. In worst case scenarios, possible septic shock, which means that it's a whole body bacterial infection. As much as possible, and not to compromise on the success of the root canal treatment, which is usually very expensive. We want to remove all the dead tissue as much as possible. Yeah. Okay. So you want to continue to your next appointment? Yeah.
Okay. So what happened was we removed all the dead tissue and we left the antibiotics, the so-called antibiotics inside for around 2 weeks. So after which I went back for treatment again. So during this treatment, again we removed the antibiotics that we actually put in, and this time we are actually putting in something called the gata percha. So what is gata percha? It's actually would you like to explain what is gata percha?
Okay. Yes. So gata percha. Gata percha. Okay.
Gata is percha, right? Gata percha.
Okay, let's call it GP. Okay.
GP.
So this GP is actually a form of rubber or latex, which is a filling they put into your tooth to fill up the root canal. Because if they don't fill it up, then there'll be just one empty tube there in your tooth, and then which is very prone to infection as well. And it can compromise the structure of the tooth also. Or the dentists will fill up with this rubber, and then this rubber is supposed to be neutral to your body as well. So it's just kind of like a space holder. Yeah, and then also I think I need to clarify the calcium hydroxide. I think Feng Hua uses it as antibiotics because it has the mechanism of killing bacteria, but it's not actually an antibiotic. By definition, it's more of like a medication.
Correct.
Yeah, temporary medication which they remove after to make sure that that tunnel in your tooth, the root canal, is dry. Then they fill up with the GP. Correct? Is that what the Dr. Lee did?
Yes,
yeah,
correct.
Okay,
so the GP must also be packed tight to avoid what we call voids. So what happens if there are voids? So when there are voids, bacteria can again go into your canal and then cause an infection again. So root canal is very expensive, and you don't want to go for it again lah.
Yeah.
So just make sure that the first time is done well. Okay. So after which, for me in my case because after my second session, I'm actually going for bleaching.
Ooh.
Yeah, because my teeth is actually discolored. So anterior teeth, we want to be nice. I'm also very vain. I want my teeth to be nice also. Yeah. So what happens was Dr. Lee will actually schedule bleaching for me in subsequent visits. But for normal people, if their teeth is not discolored, they get treated early enough. What happens is that they might actually just fill it up with a normal restoration, just maybe a tooth colored restoration.
So when you build back out the tooth, it's called a restoration. But basically, as Feng Hua said, they use tooth colored material and then they just slap it on your tooth to try and then they try and shape it to your original tooth shape. Yeah, so that's the restoration.
Correct. So for my case, I was very lucky lah. So I didn't have a chipped tooth or whatsoever. It's just trauma. So my tooth can actually just be filled up with a restoration. But for other people, for example, even you can get root canal treatment from maybe very carious teeth also. So for those, right, their tooth structure might not be there might not be that much left lah. So what happened is after their root canal treatment, they might actually require a crown. Yeah, so that might entail small visits and so on. Yeah. So maybe you can explain that.
Yeah, so as Feng Hua has talked about, he talked about tooth bleaching and crowning of teeth. So these are this depends on case by case basis. Usually dentists, when it comes to root canal treatment, the essential steps you have to do is, as he said, clean out the dead tissue, shape the tunnel so that it can fill up with kata peka, with GP, the rubber thing, and then after that, depending if your tooth is discolored, they may indicate it for bleaching. If your tooth has broken down, then they will have to restore it, as he said lah. This marks the end of your visit. Yeah, so this just nice brings me to my next section of the video, which will talk about other ways that you may need root canal treatment other than trauma. So Feng Hua has mentioned very carious teeth. So what is carious teeth? So carious teeth is more commonly known as tooth decay. So tooth decay occurs as a result of bacteria also. And then, so if, for example, if you don't brush your teeth cleanly, if you eat a lot of sweet stuff a lot and very frequently, your tooth gets very prone to having decay, and then this decay can eat into your dental pulp also, which is the nerve, and then kill your tooth. So that's when you may have to undergo root canal treatment again. And then so on top of the root canal treatment, they have to, if your tooth has broken down a lot, they have to fix it up with a crown to bring it back to its like as close to its original shape as possible. And then this is for either aesthetic purposes, especially for your front teeth or anterior teeth, and then or for your back teeth, posterior teeth is for you to bite and chew properly. Yeah, so I think this is generally it from me. Do you have anything else to add?
For me, I think one last thing to add lah.
Sure, go ahead.
Because for me, I actually haven't done my bleaching lah. My client has gotten better, but I haven't done bleaching yet because I'm actually doing auto treatment. So we actually recommended to finish my orthodontic treatment first, then wait for bleaching to take place. Yeah, so I'm actually going for bleaching maybe after my auto treatment lah. Okay, so it's another maybe 2 or 3 visits because you have to go back weekly to check on the results. So once it's okay, they will actually take out the bleaching agent. Yeah.
Go back to wait. So now you haven't done your bleaching part.
Actually, I haven't done my bleaching.
So you have to finish your orthodontic treatment.
Correct.
And then that is a while longer, is it?
I think I have at least a few more months to go lah. I've been on it for around 1 year plus already.
Okay lah. Yeah. A few more months yeah. Okay lah, but then with the braces can't really see the discoloration also, right?
Correct.
Yeah. Okay. So for Feng Hua's case, it's actually quite special, as he mentioned, because he has orthodontic braces. He has braces, which is why I decided to ask him onto this video. So because just nice he did this root canal treatment as well. Now Feng Hua and I are going to talk about the possible risks and side effect of doing root canal treatment. I have something general and Feng Hua has something more specific to his case. For root canal treatment, a potential risk or side effect that you have to take is that it may not work at all because the tooth is already dead usually, and it may not respond to the bleaching, or for some reason it may just get reinfected again by bacteria. And then when such case happens, what would the dentist do? They may try and retreat it, so they'll try and repeat the same process of drilling out everything and plugging it again. There are chances where it may still fail, and when it comes to that end or the extreme end where the root canal treatment, no matter what, just doesn't work, usually the main treatment option is they will usually extract the tooth, and then the patient may consider an implant or dentures or a bridge, depending on what the dentist suggests and their conditions as well. So by root canal treatment not working as well, just mean that the bleaching also will not work, and if the bleaching will not work, it just means your tooth will just stay discolored. Okay, so on the point of bleaching, Feng Hua has something to share with regards to his treatment so far, and there's a potential side effect also.
So for me, why I actually left my bleaching until after my auto treatment, there's actually a reason lah. Okay, so during auto treatment, one possible ortho treatment in the sense of orthodontic treatment, which means braces, layman terms. So one side effect of braces is that you might actually have cervical root resorption, but it's a very cheap term. But to put it in simpler words, it might mean that your root gets absorbed or eaten away.
Yeah.
Yes. So, but that's but actually it depends on your ortho treatment lah. If your teeth moves slowly and all, this shouldn't be a problem.
If your tooth
Move slowly lah. Like there's not drastic movement, not too big a drastic movement lah. But don't worry about that. Your dentist will take care of that for you lah.
Yeah.
They know what to do. Yeah. But for me, because orthodontic treatment actually have a risk of root resorption, which is root resorption, and at the same time, bleaching also have a risk of root resorption. Because with these two coupled together, right, it's there's a little slightly higher risk to do both of them together lah. That's why we actually do finish my braces first, and then after that I'll move on to bleaching.
Yeah. So as you can see, the dentist also manage your condition by case basis as well. So don't worry too much about it and let them guide you along the process as well. Thanks for
Thank you, bro.
let me hang, bro. But thanks for agreeing to do this video with me. At such a pretty late timing. Yeah. Yeah, that's about it from us. Okay, so do follow Feng Hua. I mean, I call him Feng Hua, but do follow him at Zettery. He also has some dental content there as well. And then, as he mentioned, he'll update more on his root canal treatment. And I think you're doing braces also, right?
Yeah.
More about braces also. Yeah. So yeah, if you're interested as well, please do follow him. If this video has benefited you in any way, in understanding more about root canal treatment, or maybe as Feng Hua said, it may be something that is scary, having a tooth knocked out like that or suddenly die due to tooth decay is something that seems a bit extreme lah, but the treatment wise is not that bad, and it's actually done to preserve your teeth as much as possible. So yeah, if this video has shed light on how you can manage your tooth if in the event you accidentally knocked it out, yeah, feel free to leave a like, subscribe, yeah, and yeah, you can follow me on my socials too. So that's all from me.
Follow him.
Okay, thanks guys, bye.
Thank you.